Kabla sijafungua.
So which one do you prefer?
This film is about a project in Southern Tanzania to provide young people with high quality information about sexual and reproductive health.
Okay, go!
For 3 weeks, a group of London-based health professionals provide intensive training for students here at the Clinical Officer Training College in Mtwara.
Somebody in the room who is left-handed. Okay, Shira, is that right?
This enables them to go into schools and talk with pupils about sex and relationships.
Sawa. Tunaenda katika kitu kingine kinaitwa nini? Kondom. Safi. Sasa hii kondom iangalie.
What's the first things that you think when you see that film? And your colleagues seeing it last year?
In our society, some girls may hide some information because of boys. They feel shy.
Yeah. I think that's very interesting. I think we can think about that. When we go into schools in London, what they sometimes do is they do some lessons together to try and encourage breaking down those barriers, and then they do some lessons separately.
My name is Hassan Msafiri, a student of Partnerships London-Mtwara. In Tanzania, we have about 5 training colleges for clinical officers, where at the end of the training, we're just going to be sent to the dispensaries in the outreach areas. At the outreach, you will not have some doctors, you'll be alone, you'll be in charge of the dispensary.
The hormone, when it's on the coil, is delivered very locally to the womb, to the endometrium, where it can do its job very effectively because you're putting it right where it needs to do its work. The training program combines lectures, small group work and role.
Condom, whichever you like, yeah? Good. And then I want you to think about how it might be to explain this to a young person or to a parent.
Usually we are not taught like that.
Why must you need a female condom if you already have a male version?
It delivers up-to-date clinical and technical information.
And then what happens? It's really good that we've all had a chance to feel what these things feel like.
It covers communication skills with an emphasis on working with young people and general relevance for use in clinical settings.
In theory, it's very different in practice. Okay?
The way the class conducted was much better. Yes.
And also when we're talking to young people, again you might want to focus your consultation down onto some that they've heard of or ones that you think might be more appropriate for young people.
Tanuru, I'm coming from Naliendele. I'm clinical officer in charge of reproductive dispensary.
My name is Dr. Shengena. I'm working with COTC and the Zonal Training Institution for Southern Zone.
The program also introduces students to participatory learning methods which they can adapt for use in schools.
Okay, so when you're in the community, people will be looking to you to give a strategy and a structure. So this exercise is hopefully going to help you to think about the bigger picture around teenage pregnancy and how you could involve the 3 groups. So the community parents, the teachers, and the rest of the health professionals that you work with.
Each group of students produces a report, which is an opportunity to hone their research, writing, and presentation skills.
That's a question.
Is that a question or a...
Me as a clinical officer, when we educate them on how to be safe from the problem, we make sure that we be careful not to interfere with their beliefs.
Yes, suppose that I'm a teacher and I'm teaching a single faith school.
And the way we study here, maybe just for examination, maybe, and only for myself, for ourselves. But the way you're training us to face the community, to build the confidence to us.
The program is very nice because you have got problems about this youth age who almost, especially girls, get early pregnancies while they are in school.
Somebody come and take the chalk and we do one change that happens during puberty, and you can tell the class and then go and draw it on the boy or the girl. I want you to think about other things, not just physical, maybe some emotional things.
I'm fine.
Are you okay?
I'm okay.
So now, how are your decision?
I'm going to school.
True.
Yeah.
My name is Hussein Kilwanila. I was born in 1979. So when I was in the Kotisi, I was also working with the community. We established an NGO which is called Ngome to provide health education and to raise the community awareness about health issues. 2007 we met PaLM. So we worked with PaLM last year when I was in school at Kotisi. It was good. And after the preparation of our classes, it means it was our way to go in the community. We went to Nalindere. When we went there, we took the students, it was class 5, class 6 and class 7. We found that the community, it means the parents of the students, also wanted to know. We made a lesson plan and we taught them. This year, PaLM have expanded their programs to Mikindani.
Baba atakukubali. Endelea na masomo. Mbona madhara yake?
Inazuia nini kutokana tulivyowafundisha. Yaani wazazi wawili kukubaliana, baba na mama.
Kwanza yuko wapi jamaa sasa?
Sasa hivi yuko wapi, si mwenyewe anahangaika kwa mitaani, wanawake kila siku kibaba.
Lakini mshikaji fresh.
Sasa tunamwambia tena kweli.
Ni wangu anasumbua chini kila siku na mama.
My name is Petron Felix. I am a head teacher of this primary school.
Nyinyi weka kwenye maneno matatu wewe. Tuishi kwa matumaini matatu. Sasa ule ujumbe bado, yani tuishi kwa matumaini ule ujumbe.
Is the Glasses Makot. I'm clinical officer. I'm also a volunteer of Ngome.
Ukiwa na subira lazima utaipata.
But at the end of our discussion we found two things. On the side of the pupils or students, they decide that there is a need of having a group. We can call it a peer group.
We're creating a peer group here now.
But on the side of the parents also, they say they should have some sort of committee.
Itakuwaje mme wangu ligula huko? Sasa nini kitakuwa? Kaja mshangaza kisha kuchukana ndugu na jamaa.
Hapa kidogo basi nikuelezee.
So now we left two things and they're going. The peer group of the students and community and development committee of the Nalindere.
Ungejulikana wengi tungekimbizana, waume kwa wasichana, ni nani angesalia?
Currently, people now have a great awareness in Nalindere about reproductive health, but we hope we will go on and go on and go on.
Thank you.